So we're not really in miracle treatment territory, but we're also not in it does nothing territory. We're in an area of nuanced medicine. Hi, I'm Tina, a naturopathic doctor with over 20 years of experience working in both a clinical setting and a hospital setting. And my goal is to deliver education and help women navigate the healthcare system and the nuances of holistic medicine. Today, I want to tackle the question of whether or not acupuncture helps improve fertility. And as you've probably guessed it, the answer is both yes and no. It depends. And if you find this topic interesting, please like and subscribe as it helps me to continue to make educational videos. So today I'm going to address what it is, how it works, and how timing and dose matter. And the fourth point, who truly benefits. So starting with what is it? Very simply put, it is the placing of tiny little needles, basically 2 hairs in thickness, into different areas of the body. Now, there is an Eastern approach to this and a Western approach to this. The Eastern approach takes acupuncture viewpoint as trying to restore the qi, which is the body's natural energy flow. And it tries to promote and restore balance to the internal organs. The Western version of all of this is what we often call dry needling. And it's also the placement of the same tiny little needles, but sometimes in TCM points, traditional Chinese medicine points, but also in other body parts, i.e. near a nerve root or near a muscle knot or through a muscle knot. And basically what you're trying to do is target the nervous system. How might it actually work? The mechanism of action. It is thought to tackle both systems, the nervous system and your hormonal system. By adjusting your nervous system, you can actually control the circulation to your ovaries and your uterus. And by targeting the hormonal system, especially the endorphin pain management system, you can help balance hormones. The reason fertility clinics are slow to actively recommend is that these studies are somewhat small and they're not uniform throughout, and they may hold some bias. But the findings are still statistically significant. It's actually not a magic fix, but there are a few groups, a population group, subgroup, that actually do show benefit. And the benefit does depend on the timing, the dose, and the specific fertility issue. The total body of evidence show roughly 47% of studies, including several large meta-analysis and randomized controlled trials, improvement in pregnancy outcomes. Around 26% say possibly promising but inconsistent findings. Roughly 21% show mixed results compared to no treatment. So we're not really in miracle treatment territory, but we're also not in it does nothing territory. We're in an area of nuanced medicine. Let's look at who may benefit the most and whether or not it's worth your money and time. So far, the studies have shown that if you're someone who has recurrent implantation failure, PCOS, or poor endometrial lining thickness, this would be a good add-on. In women with ovulatory disorders, in particularly PCOS, polycystic ovarian syndrome, randomized trials showed higher ovulation rates, higher cycle per pregnancy rates, and improved hormonal patterns, and better endometrial blood flow. So especially when medications like letrozole or clomiphene are added. This is the one area that the signal looks very consistent and strong. For others, such as luteinized unruptured follicle syndrome, which is when the follicle matures, the body produces normal hormonal signals for ovulation, and the follicle even luteinizes, meaning it starts acting like it ovulated, but the egg is actually never released. And the meta-analysis in those conditions of 15 randomized controlled trials found ovulation actually increased by 25%. Pregnancy increased by 22% versus controls, and that's meaningful. Still not definitive, but clinically relevant. In regards to endometrial receptivity, some reviews suggest that acupuncture may increase endometrial thickness, improve blood flow to the lining, and improve hormonal balance. The only problem with these studies is that they're small and heterogeneous. So we can't really come to a final conclusion. Is it possible? Yes. Definitely proven? Sadly, not yet. But we do know that it also acts on reducing stress hormones, cortisol and adrenaline. And having been through fertility treatments myself, I can tell you they are stressful. And stress doesn't actually just make you feel bad, it actually does change your hormonal regulation. Chronic stress can raise cortisol levels, which can disrupt ovulation and produce lower progesterone levels. Research has shown that acupuncture sessions can lower your cortisol and decrease sympathetic nervous system activity, which can alleviate anxiety and stress associated with the uncertainty of IVF outcomes. So, even if acupuncture isn't directly boosting your fertility hormones, it may be creating the conditions that your body needs to conceive. IVF and ICSI, multiple meta-analysis of randomized controlled trials show when acupuncture is added to IVF, clinical pregnancy rates increase. Relative risk ratios are typically around 1.2 to 1.4. That means roughly a 20 to 40% relative improvement compared to IVF alone. And some analyses show higher live birth rates, although that signal is a little bit weaker. A more recent meta-analysis between 24 and 2025 actually confirmed this pattern, showing improved clinical pregnancy, improved live birth rates, especially when acupuncture is done over multiple sessions and for longer durations. And what are longer durations? 2 to 3 months leading up to the IVF transfer. So why might this work? Possible mechanisms include reduced sympathetic nervous system tone, improved pelvic blood flow. With improved circulation, you have increased oxygen, calcium, magnesium to the areas that you would like it to go to. Stress reduction, improved patient adherence and engagement. And I mean, the stress reduction alone might be clinically meaningful in fertility care. And remember, fertility outcomes are influenced by physiology, the quality of the embryo, psychology, behavior, eating patterns. Medicine is rarely a single variable. And what you also have to keep in mind is that one large meta-analysis also found a higher miscarriage rate in women receiving acupuncture during IVF treatments, despite higher pregnancy rates. That does not mean acupuncture causes miscarriage. Maybe it means that acupuncture helped an embryo implant when it should not have, i.e., bad genetics. Or maybe a point that was needled should not have been needled. Or maybe it was done too soon or too late. We don't know. What that does mean is that safety and timing does matter, which is why going to someone who is a professional makes a difference. Personally, I interpret this information as proceed cautiously. Typically, we don't recommend that you needle the first 3 days after an IVF transfer. And if the patient insists on it, then the needles are placed in an area that's not stimulating, and definitely not in the abdomen either. Now, does timing and dose matter? This is where the headlines that say acupuncture is great for fertility miss the mark, because acupuncture isn't a one-session intervention. The research suggests better outcomes when the acupuncture started during ovarian stimulation or several cycles prior to egg retrieval or embryo transfer. That means 2 to 3 months before you actually start your IVF or have your IVF treatment. It's a therapeutic course, not just a quick add-on to do on day of transfer. Unless you're looking for psychological support and stress relief, at this point, that may be a benefit. For frozen transfer specifically, acupuncture did show improved clinical pregnancy, increased endometrial thickness, but it is unclear in the improvement on live births, and the data on that is limited. So is an acupuncture a yay or a nay as an addition? Here's my conclusion. Acupuncture should be viewed as a complementary therapy and not a standalone treatment. It may modestly improve pregnancy rates and possibly improve live birth rates, improve ovulation and certain disorders, improve endometrial parameters. But it's important to keep in mind that the study quality is of a whole bunch of different varieties. So no, it's not a replacement for fertility treatments if that's what you're undergoing at this time, but it is potentially a supportive adjunct. The no to all of this is if needles actually stress you out, then there are other options like reflexology, massage, cognitive therapies. And if treatments have completely gutted your bank account, then you might not want to invest extra in this, because the added financial stress is not going to be working in your favor. Acupuncture may be considered reasonable for patients undergoing IVF who want adjunct therapy and who don't want to leave an extra percentage point on the table, especially after spending thousands on treatments. Women with ovulatory disorders, in particularly implantation, failure to implant, and PCOS, and patients seeking low-risk supportive therapy. It may be less compelling if it's used as a one-time IVF add-on, and definitely not as a replacement of medical fertility treatment. And if anyone presents it as a guaranteed success tool, please just run away. So my final take on this is that yes, there is modest benefit, especially when you tack it on to IVF treatments. But it's not a cure, and the majority of the benefit seems to be done if you're doing acupuncture consistently leading up to your IVF transfer. And infertility, which is high stakes, even a modest improvement can matter. If you want to find out now how sleep might be affecting your fertility for both men and women, please watch the next video. And please like and subscribe as it helps me to continue making educational videos. Thank you. Hope you found this useful.